So we're going to talk about PRP tonight. Had anybody heard about this before we started talking about it? Been reading about it or heard a little bit? So you're going to learn a lot tonight. So what is it? PRP stands for Platelet-Rich Plasma. And it's too hard to say. Say that 3 times fast and don't get tongue-tied. But it's PRP. And I'm going to tell you all about why this is magic. And I want to tell you I was pretty skeptical about this when we started. I've been hearing about it for a long time, and PRP's been around. It's not really that new. It's been used in orthopedics for a long time. A lot of the bone doctors use it for joint injections. Athletes have been using it forever. Pro athletes are getting this stuff all the time to help their joints heal or after surgery, whatever. Racehorses get it. I guess they're kind of athletes. So this has been around for a long time. There's some dentists and oral surgeons here in town that no longer do dental implants without PRP. So it's being widely used, but the world of aesthetics was kind of new. And so I was a little skeptical. And if you have a doctor who's not a little skeptical about new stuff, you probably need a different doctor, you know. But I was, until I started going through all the training and doing the reading. And then, you know, when we finished up our certification, the results were so amazing that we were like, we have to be doing this because it's really better than anything that we've seen. So this is what it looks like. When you come in to do PRP with us, whatever the procedure, we're going to take a tube or 2 of blood, and these tubes have a fancy little matrix in there, and so when we put them in our centrifuge and spin it, the red cells go down to the bottom and can't come back up, and we get all this nice yellow plasma at the top. From now on, call that liquid gold, okay? Because that's what it is. So we get the plasma. Plasma has platelets, platelet-rich plasma. It's a highly concentrated little grouping of these platelets, and platelets have growth factors. And growth factors are little gold nuggets. They're literally liquid gold. And here are the major growth factors that have been studied the most. Some studies have shown that there are up to 60 growth factors in the plasma. These have been studied more than any because they want to know exactly what are these things doing when we inject them. There are other molecules in the plasma that do some good things as well that we're going to talk about. But these are the key ones. So what do growth factors do? So without getting all sciencey, when these growth factors come in contact with other cells, whether it's skin or bone or tissue, they send a signal. So think of them as signaling molecules that sort of stimulate regeneration. And this is a word that you're hearing a lot in the aesthetic world, and we're going to hear more, because if we can take our own stuff, our own plasma, and make our own tissue better and healthier and younger, why would we not do that? So regenerative medicine is a big thing right now, and it's really big in the world of aesthetics, and largely because of PRP. So what does that do? First of all, we get new cells, and I've never encountered anything that actually produces new tissue. New skin cells, new fat cells where we're losing volume. It can be used to generate new bone cells. So we're literally getting new, healthier tissue. We get cell growth, and as you know from looking in the mirror, things shrink as we get older, right? Our cells age, they shrink, they get smaller, they get weaker. We can actually cause the cells to grow and regenerate. Damaged cells can get better, they can be repaired. What damages our cells the most of anything? Sun. Okay. Y'all are learning. I say that every week. And it causes us to get new collagen, and your skin's best friend is what? Collagen. We want it. We want all we can get. And it promotes wound healing. Some people are using this for, like when I have a patient who has a stasis ulcer, a diabetic foot ulcer or something, you can inject this stuff in there and they can get healing of their wounds. We're using it after we do our CO2 laser. So it literally promotes wound healing. All right. So how's it used? These are all the things that we're going to go over tonight, and there are more uses. These are just the ones that we're going to talk about, and we're not going to stay all night. We're going to go fast and then let y'all answer questions or ask questions. But so vampire facial with micro-needling, the vampire facelift, hair restoration, acne treatments, scarring, the breast lift, the O, the P shot, and then some incontinence issues I want to tell you about. All right. So we're going to start with the vampire facial and micro-needling. So these are two different things that we're combining. Micro-needling alone, I'm going to show you this. This is the micro-needling device. The tip down there has the needles, and the thing oscillates up and down so rapidly you can't even see it. So we're literally making little punctures in the skin, and this lets us dial the depth. We can go shallow or deep depending on where the skin, what skin we're treating, because some areas are thicker than others and some are thinner, so we can adjust the depth. But we're using that micro-needling, and if we did nothing else, the skin's going to get healthier. Just by puncturing the skin, you can improve scarring and you can build lots of collagen. So we take that and we combine it with the PRP, and then we get a double whammy. So the PRP is actually going into the little tiny puncture holes, and once we do the microneedling, the holes are open for about 15 minutes. And that PRP is just sucked right into the skin and down to the deeper layers so it can go to work and do its magic. So wrinkles, fine lines, skin tightening, the skin texture and tone, pigment damage and sun damage, redness. Somebody asked me earlier, can it help with redness in vessels? Yes, it can. Like people who have rosacea. Acne, you're going to see some pictures, scarring. And the wonderful thing is there's minimal downtime. Lane and Tina had it done Thursday, I think. Here they are. Some redness for a couple days. They're a little flaky, but there's no downtime at all. So.
And I'll look 18 in a few months.
All right, these are some areas that we can do. If you can name it, we can treat it with microneedling and PRP. The scalp, we can do some for hair restoration, and we're going to talk a lot more about that. Scars, like acne scarring, the back of the hands, the neck, the chest, the décolleté. I can say that, it's a French word. But I can't spell it, but I can say it. Little crinkle lines under the skin, do y'all hate those? I hate them, they're very difficult to treat. We can treat that with the microneedling and the PRP. Jawline, neck, anywhere else you can think of that's a problem can be treated with this. Okay, y'all don't know who this is, I'm sure. You only see her 40 times a day. So she went down to Fairhope to try this, and she's actually had both the vampire facial and the vampire facelift. And lots of Hollywood people go right down to Fairhope, where we finished up our certification, and go to Dr. Ronald's place, which you wouldn't believe, and they have their deal done. So she snaps a selfie, and as Vicki said, it became a phenomenon, not just in America, but it's all over Europe and now in Asia. I mean, this is being done everywhere. It doesn't really look this bad. This is Kardashian's deal, you know. But afterwards, we don't send you out looking like that. You know, we do wipe you off. But that's how it looks. So here's some before and after, so I want y'all to help me. Before and after. So what do you see that's different about this patient? The eyes. Amazing, isn't it? Yeah. No fillers or anything. This is not the facelift. This is microneedling. What else do you see?
Her cheekbones.
Cheeks look higher and tighter. What do you think about the color of her skin? Does she not look younger and healthier? Just looks prettier, doesn't it?
But that's no makeup. Really? Wow.
Skin tone's even.
The tone is even.
That's
Yes.
very cool.
All right. What do you see here?
Around her mouth, eyes,
Mouth, eyes are amazing. Yep.
nose.
Look at the chin.
More toned.
It's peau d'orange, another French word. Looks like the orange peel, but look at the difference. Just the skin tone, as Susan said, much better. What do you see? So
That's
wow.
pretty unreal.
Isn't that crazy?
The scar is not as deep.
Yep, that's right. Look at her eyes. And again, the skin tone, just much more even and smooth. Yep, around her mouth. All right, so this is acne. This is a pretty severe case, but we are using one of our lasers now, our sublative laser, and we're getting some pretty incredible results. But this adds another element, and we can now combine these. But this is microneedling alone without the laser. So that's incredible, isn't it? These people have a lot of trouble getting their skin smooth again. It's very difficult. This is kind of a combo of active acne and scarring. Isn't that crazy? This is stretch marks. Anybody got stretch marks? Don't raise your hands. Guys get them too, believe it or not. Guys get them too, but women are kind of penalized because of babies. But we can treat stretch marks, hips, anywhere you have stretch marks, they can be treated. The chest, what do you see there?
The lines
are gone. Not only the big deep, the little fine lines, but the big deep lines are gone, and the skin just looks fuller, doesn't it? More, it just looks healthier. It's another one. Yeah. She had some really deep lines here, all gone, and that's just from microneedling. All right, so I want to stop with each little section because we're going to go through a lot. And I thought maybe you could just, if you got questions, let's talk about it on that subject, and then we'll go to the next one, and then we'll take all questions at the end. But any questions about microneedling with PRP?
Was that the microneedling with PRP on each one of those?
It was.
And was it just the one treatment?
Most of these people have gotten 3 treatments, and that's what we recommend. You can do 1, but we recommend a series of 3. Yeah.
How far apart?
About a month apart. Yeah. And with the downtime, you know, there's a day or 2 of redness, but you know, not a big deal to do it 3 times. Any other questions? All right, so let's talk facelift. So facial with the microneedling is basically skin. But you can see some pretty amazing improvements, but facelifts are different. And some of you have already had fillers, you know about those, but we're taking it a step further because we're combining fillers with the PRP. So things below our skin are happening as we age, and we have sort of shrinkage, right? Everything shrinks and gets smaller. Our bone regresses. And one of the reasons we get sunken eyes is because the orbits literally, if you look at anatomy, it literally enlarges because the bone's regressing. So we don't have the support there from the bone. The fat pads that we're born with get smaller and more shallow. The skin, all of the skin support structures just fade. So when we have that situation, we have to do more than just treat the skin. We have to treat what's below it, and that's when we inject fillers, and now also we can use the PRP. This gives us big advantages. Fillers have some wonderful advantages. They have firmness, we can give shape, we can do lifting. PRP we can inject into areas where we don't feel comfortable injecting fillers. The eye troughs we do a lot of here. I think we do amazing eye troughs with filler alone, but there's a limit to how far you can push it with fillers. You have to be very cautious. Now with PRP, you can just inject that stuff under there because it's your own stuff. It's just plasma. It's not going to do any harm. There's 0 risk. So it's really expanding what we can do with the injectables. So it's all natural. It's your stuff. There are no side effects from PRP because it's your plasma. We took it out of you and we put it back in you. We've just concentrated it to get the liquid gold that we showed you. It's non-surgical, no downtime. It's regenerative, the same as we talked about with the skin. This is forming new tissue. We're actually improving the quality of what's below the skin. New blood vessels come. You saw the young lady that had those, just her better skin color. That's because she had better blood flow. Reducing wrinkles and lines. Nobody has those here, but no side effects. Really minimal pain. We do numbing and everything, so there's no real pain with it. All right, so what do you see? This is a vampire face lift.
Your cheekbones are a little prominent.
Cheeks are crazy good, aren't they? Yeah. So if I have my laser pointer, but see the darkness under her eyes, and she has great cheek lines here, and we want those high cheekbones. Think Angelique, but they come around, Angelina. They come around, and they should continue to the front and give us shape in the front. It should be plump up here. But see how flat we are here? And when this flattens out, everything goes down. So now look. She has a nice little roundness on the front. Her eye troughs have disappeared, and the texture of the skin is better. They've touched up her lip corners, enhanced her lips a little bit. That can be done with the PRP as well. All right, look at this.
Wow.
So the skin's kind of obvious, but what else do you see?
The lines are gone.
Look at the flattening here. And look at the depth here. You know, again, without this support, this is hanging down. There's nothing to lift it up. Look at the difference here. She's got a wonderful cheek line. It comes all the way around below her eye. The nasolabial folds are better. Come on, can y'all see? Chin line's better. Look at the jawline. Crazy. All right, what do you see?
That's a world of difference. Fullness.
Cheeks are more full. Again, the flattening. And I look at this is one of the first things I look at when I'm sort of checking out what we're going to do. You know, we want that front to be full and lifted up. So she's got that now. Look at the marionette lines here, much better. Look at the texture and color of her skin.
I mean, she has a definition.
Neckline's better just because everything got lifted, yeah.
And this is just the platelets.
This is the combo of filler and platelets.
The filler and platelets.
Right. That's the vampire facelift uses both. Right. Small amount of filler and a lot of PRP.
How long does it take to get that?
You're looking at about 3 months here. Yeah, it doesn't happen quickly. With PRP, and I should have said this earlier, kind of think of 3-3-3. You're going to look fantastic for about 3 days. Okay? You're going to walk out of here going, whoa! And then it's going to fade, okay? Because the plasma is going to fade a little bit, and the platelets have, and the growth factors have to go to work. At about 3 weeks, they're really working. At about 3 months, you're going to get your full effect. So 3-3-3.
And is that just one treatment?
Yes, the facelift is one treatment. That's right. All right. Questions about the facelift?
How long does it last?
It's permanent. And the reason is fillers aren't permanent. As we've talked about those. Our fillers last 1 to 2 years, but PRP is forming new tissue, and so the clock keeps running. But we're resetting the clock, and we're going to age again. So eventually we'll need more. But it's your own tissue. We're forming new stuff. All right, vampire.
So, Dr. Gill, I have
Yeah.
one question. So with the one we just talked about, where you use the filler, when you're using the platelets, do you use as much filler?
No,
Okay.
no, it's 1 syringe of filler, and we're using that basically to get some shape and lift. Now, in fairness, some people may need more than that, depending on the extent of their aging and their problems. But the vampire is 1 syringe of filler used strategically in some certain areas, and then the PRP. Other people,
Versus what would it be normally?
well, I may use 2, 3, 4, 5, 6. I mean, it just depends on what people need.
Wow.
And when you do the PRP, is it, you inject it?
Mhm.
You do, okay.
Yep. Same as
when
fillers.
you do the filler.
Same as fillers. You can just use it in different areas, and you can be more aggressive. Okay, breast lift. Everybody's excited about having surgery for breast lift, right? Because it's easy, you just go back to work the next day, no problem. Breast lifts are a big deal. I mean, it's a big operation, it's expensive, and lots of women need them and want them, but, they think twice about it. So, I was stunned by this. This really convinced me as much as anything when I saw the results of this. We did a whole bunch of them, and I was amazed. The benefits are, again, natural. It's your own tissue, literally new breast tissue forming, non-surgical, no downtime, much cheaper than an operation. Can be done with or without implants. That's an important point. Lots of ladies have implants, but even that over time, they get weakness of the tissue, so they get some sagging and they're disappointed. So their options are just have them redone, which is, again, even harder the second time because of the scarring. Enhances cleavage and fullness, and you'll see that in a minute and the reason why. Reduces sagging, improves sensation. Lots of ladies lose sensation after breast surgery, after breastfeeding, sometimes just with aging. So it can help that. And just like the face or other areas, the skin texture looks better. So here we go. This lady had implants, and you can see there's a gap here. And I don't know if you've examined a lot of women, but but this happens a lot with breast implants. So it just doesn't look great. She wasn't happy with this, and you can see the sort of the ripples in the skin, and the implant had just shifted over a little bit on one. So with the vampire, this is what you get 3 months later, and this is all being injected on the inner part of the breast. We're not trying to enhance the lateral body of the breast. It's all being done here in kind of an S-shaped pattern. So the gap is narrowed, it looks much more natural, the cleavage is much more natural, and the breast just looks fuller. All with an injectable that took 30 minutes if you're chatting. I mean,
And did they do any filler on her?
you can use filler here. Like, she needed some filler because she needed a firmer substance than the PRP. So filler was put in here, and then PRP did everything else. So you can use a little filler in there too if you've got certain defects.
And even with this, you look great for 3 days and then it goes away.
Pretty much. Yeah. So if you got a big event and a low-cut dress, you know, you can plan it. That's right. You got 3 days. Kind of like Cinderella, you know. All right, take it on in. All right, so this is another one, and we've got frontal and lateral views, but same picture. It was all done on the medial part, and you can just see how much fuller the breast looks. It's very natural looking. This is a smaller cup size, but it still works. So it just gives her a much more natural, full look. Yeah, crazy.
And
It
is
does
this
look like
one
that.
treatment, Dr. Gill,
Yep,
or three?
one treatment.
And it's just PRP?
Yep, just PRP.
That
And
is
again, you can do
amazing.
you can treat some specific defects with filler
Yeah.
combined, but not
That
not
is
everybody needs that.
That's-
I know.
That's very wild.
So she looks like she had a lot of filler.
Yeah.
Yeah.
Do
Well,
you think?
Looks like she had implants.
we did it. You know, we're using about 5 cc's, about 10 cc's,
I mean,
5 on
that's
each
not a
side.
lift. That's like
Yeah.
incredible.
This was one of the ones. I'm pretty sure this is one of the ones that we did at the when I was in Fairhope, and I mean, I'm telling you, I was just standing there going, that's just incredible. You know? I mean, it is.
Wow.
All right. Any questions about the breast lift?
Is that permanent? Like the
Permanent tissue, new breast tissue, yeah. Unfortunately, we keep aging.
I guess over time it will, it will.
Over time,
it will, just like
just
everything
like
else, as you
anything
get
else.
older, it will, yeah.
We're
3
just-
years, 5 years.
Probably 3 years. This is so new. People are saying, "Oh, we don't know how long it's going to last." We think 3 years for sure. Maybe 4 or 5, maybe longer.
So does it lift them up? Like,
Yes.
lift them up?
Well, I mean, I think all this, you know, about
Yeah.
Well,
It's
but
not,
that-
it's not, yeah, it's not like
It's not
that.
very like they used to be, I
No,
guess.
no, we're not going back there.
We're not going back to 2016, I guess.
I mean, honestly.
But that last
is
picture, that girl didn't have much to lift.
No, she
Yeah.
didn't.
I mean,
It's just fuller, it's just fuller,
It's
yeah.
just more, just full.
Yeah.
yeah.
And if she's wearing a dress with a, you know, with an open top, I mean, she's going to look so much better. It's just... Any other questions about that? All right, so let's talk about hair loss. It's a big problem. There are not many days that go by in my medical practice when somebody doesn't come to me about this. I mean, I talk to people about it all the time. And I'm telling you, we have had limited resources in treating this. I don't really believe some of these stats. This says 35 million men experiencing hair loss in the U.S. right now. The others are 16 years old or lying. Okay. But guys lose their hair. They just do. 21 million women. I don't believe that. There's 320 million people in the U.S. Lots more women than that. They come to me all the time, and it's heartbreaking. I mean, guys kind of, you know, they hate it, but it's going on with life. But it's a big deal for ladies, you know. And you can see it gets worse with aging. Age 35 men, about 40%, 60, 65%, about 80, 70% of guys have lost a significant amount of hair. Women by age 60, about 80% of those have lost significant hair. So, you know, concerns them. Here's some fun stats. 47% of people surveyed would say they would give their life savings to have some hair. Crazy. All right, 60% say they want hair more than money or friends. I don't know if they got a lot of friends or
Maybe they have friends. That's right.
30% will give up sex if they get to have hair. Sex hair.
But if they had hair,
They
They might have more sex. That's right.
that's a win-win over
So,
there.
all that to say, it's a big deal.
Yeah.
All right. So here are the benefits. Before we get to that, how do you think we treat hair now, hair loss? So in guys, we have a pill that we can use. It amazes me, very few guys know this, but a Propecia or finasteride we can use. Pretty effective. It doesn't work for everybody, and it doesn't restore everything, but it's pretty effective. Rogaine, you can go to Walgreens and buy on the shelf, and both for men and women. They sell a weaker version for women. Don't know why they need the men's version. But you got to use it every day, twice a day. You know, it's a big deal. Beyond that, what's our other option?
Shampoo for women that you can use.
The Rogaine?
Knox.
Yeah. Questionable.
I know.
Yeah.
Well, I've used it because I have a little bit of thinning, and I get that from my mother because she gets it from her father.
It's a family trait.
Yeah.
Right.
So yeah.
But you know, nothing just really is super effective.
Right.
I mean, you try to put all these things together and use more than one piece of the puzzle. And then the hair transplant, which is a very expensive, pretty time-consuming deal. They do have some amazing robotic surgery now for that, but it's really expensive. So the benefits of PRP, again, natural. If there's a hair follicle there, we can stimulate it, make it wake up. No surgery, no downtime. Really not very uncomfortable, just a needle injection, and we can even numb up the scalp if we need to with nerve blocks. It's much less expensive than a transplant, and we can combine it with these other treatments like Rogaine and Propecia and the vitamins and the shampoo and whatever, so we get even a better result. So I thought I'd show you some before and afters. I see this patient, you know, this type of patient every week, and they just say, what am I going to do? And it's really heartbreaking. Most of these folks are getting at least 3 treatments. That's what we recommend on hair, or I'm sorry, 4 treatments on hair restoration. We do 3 on the microneedling. And assuming we get the results we want, then it's going to require maintenance about twice a year. So 4 treatments spaced about a month apart. All right, this is a young lady that really had some receding hairline. Let's see, let me get in the way. Again, I see this all the time, just some general thinning. It's a family trait. You know, we do a medical workup for thyroid and, you know, all the medical problems. I mean, I'll rarely find something I can reverse. Once in a while I do. And here's a guy after just 2 treatments. Here's another one in the frontal area. It's a really nice improvement.
How many treatments right there?
Probably 3. Most of these are 3. Yeah.
Wow.
Any questions about the hair? And it's really brief. We're using Dr. Rappaport's protocol. Dr. Rappaport is famous for this. He basically took PRP and figured out how to make it grow hair. He's in New Jersey, and that's all he does all day long is inject people's hair. And we're like, I don't know, I gotta have something else to think about. But that's what he does. And he's got a protocol, and we just follow his protocol, and it's been proven.
Is it done similar to the micro-needling?
Well, you can microneedle. If people, for whatever reason, don't want to have an injection, you can just microneedle their scalp. But I don't think it's as effective as the injection. We're literally injecting this down below the skin. Yeah. We did a lady last week that has alopecia totalis. I don't know if you know what that is. Total hair loss. And we injected her in about, it took 20 minutes maybe. She didn't have any numbing cream at all. And
She refused the numbing.
Just didn't want it. Yeah, she did great.
We used the Zimmer. She said that made a big difference.
I didn't mention that, but we have a Zimmer. It's a cold machine, blows cold air, so we use it for any of these treatments, lasers, whatever. It makes the skin a lot more comfortable. Okay, so this is going to be the adult section. Yeah. All right.
No, I act like I'm too.
So I learned a lot when I got certified on this. Being from the South, we're just not like the rest of the country. So we were the only people from Alabama. There's very few people in Alabama doing this. People from New York, California, all over. We have people from other countries that are training.
Yeah.
And so we go through all the training stuff, and we're like, okay, time to do the procedures. Who wants to have an O shot? People were just like, I'll do. Just taking their phone. What? And like there's 15 of us standing around going, okay. And who wants a a pea shot? I do. Climbing up on the table and just, there we go.
I would think
So,
so, the ones from
They
Alabama.
come by and say, you want a pea shot? I don't think so. I'm good. And I'm not a prude. I talk to people all day long about their problems, and they tell me stuff you would not believe. But just, in a group setting, it was a little unsettling. So,
We are
anyway.
going to dinner with these people.
And yeah, then we went out to eat with them. I was like,
So what are you talking
how's
about?
it going down there? Just broke some barriers down. So anyway, having said that, we can all just relax and be Yankees today. All right, so I do want to talk for a second seriously about urinary incontinence. I treat this every day, all day, and it's a tough problem. Most of what I do is medication by mouth, and it's not really very effective. Most women eventually have problems with bladder control. It's just a fact, and it's an anatomical thing. Men have a sphincter, a muscle that actually helps control the bladder. Women don't. And after babies and aging, the tissue just weakens, so there's nothing around the urethra to give them that control. So most women, when they're honest, are having some leakage. Some are having terrible leakage. So we give them pills. It dries their mouth out. I had a lady yesterday that was losing her teeth because her mouth had gotten so dry, and it still wasn't working. Next step is surgery. So how many of you want a bladder sling? There's some good success with them, but they have their own set of problems. So if we can do something with an injectable and give these people bladder control, it's pretty amazing for them. And so the urinary incontinence treatment and the O-shot kind of go together because anatomically it's all right there. The clitoris, the urethra, and the bladder floor are within just an inch. So when we can inject the PRP in that region, it really dramatically can improve their bladder control, and it's almost instant. So, and when we actually did the injections and you feel it, it's like, why didn't somebody think of this before? It's so crazy. So, urinary incontinence is a big deal. The O shot, you might know what O stands for. All right, y'all didn't let your guard down. Nobody's relaxed. It's orgasm. Okay, there you go. So lots of people have sexual dysfunction. We talk about it all the time, and we're laughing about it, but it's a big deal, like those people said, they would give up a lot if they could. Anyway, so by doing these injections, it can sort of regenerate this tissue that has aged, basically, and reduced in size. So we can plump it back up, make it much more sensitive, so they're much more sexually satisfied. And you see the LEO, the laser enhanced O-shot, we're already doing the intima now, and we have lots of our ladies, because of loss of hormones, the vaginal tissue is becoming aged and dry and uncomfortable for them. They're having a lot of pain during intercourse. It almost becomes impossible. So we're doing that already, and the results have been really good, even with improved bladder control. But now we can combine these two. And we can treat not just the entrance and the clitoral area, but the entire vaginal lining. So it's really fantastic. Anybody know what P stands for? Okay, priapus. Y'all's mind was in the gutter. All right, it's a priapus shot, which is what y'all think it is. And same thing, men are having this problem. I write Viagra, Cialis, Levitra, there's half a dozen of them. I write them all day, every day, and guys who don't have it want it. If you're over 40, guys are wanting this. And it's not always effective, and there are other problems. Men get a disease called Peyronie's, which causes a hard plaque, and it can be real painful for them. This can be helpful with the ED, with the plaque. It can be really successful for them. So I'm going to kind of leave that there, but during the little consultations, if you want to ask details, we'll talk in some detail, and that way nobody's embarrassed. But it's really an impressive thing and a way to help a lot of these people who are uncomfortable talking about it and really don't have that many great options.